Welcome to Health in Today's Woman. I'm your host, Dr. Kelly Williams. As always, this show is designed to help women become champions of their own health care. Tonight we're going to take on a topic that has really hit the forefront of medicine in the last several years. For years we had no understanding, or very little understanding, of the inner workings of the brain, and therefore had a hard time really deciding on how to treat the problems that occurred in the brain. What I'm getting at and what we're going to talk about tonight is strokes. One of the things that has really changed in stroke care in the last several years is we no longer think of stroke care more along the lines of a heart attack, and we are able to treat these problems and prevent future complications. To have a better understanding of this, I've invited Dr. John Witt, a neurologist at the Murfreesboro Medical Clinic, and Ms. Sylvia McLaughlin, who runs the stroke program at Middle Tennessee Medical Center in Murfreesboro, Tennessee. I want to say thank you for both of y'all coming today.
Thanks for having me.
And I want to kind of start off with this idea. A lot of people don't even understand what a stroke is. Can you tell me a little bit about what a stroke is, John? Kind of start from there.
Certainly. Well, very simply, stroke is a situation where a part of the brain loses blood flow, usually due to a blood clot that forms in an artery or lodges in an artery of the brain. Probably 80% of strokes are by that mechanism. About 20% of strokes occur because a blood vessel breaks or bursts and causes bleeding in the brain. Either of those types of stroke tend to produce symptoms in the body that are recognized as what we call focal symptoms. So they're often on one side of the body: weakness, numbness, vision loss. Can also include confusion, difficulty speaking, dizziness, problems with balance.
One of the things I want to get here too is because we talk about two different things. Sometimes we use the term CVA, which stands for cerebrovascular accident. The other thing we'll oftentimes use is something called a TIA, or a transient ischemic attack. And I want you to take just a second to explain to us the difference between those two, because I think that's an important understanding for patients.
Sure. Well, cerebrovascular accident is actually an old term, and we tend not to like it in some ways because most cerebrovascular accidents are no accident. They happen as a result of a lot of things that we can prevent. But a completed stroke, or often called a CVA, leaves behind a damaged area of brain, whereas a TIA, transient ischemic attack, sometimes called mini stroke and goes by other terms, produces a temporary loss of neurologic function. So perhaps a temporary paralysis or vision loss or numbness, which goes away in a matter of minutes or hours.
And they don't have any prolonged effect. Those are patients who will not have long-term vision loss. It'll be a short-term vision loss and should return to
That's right.
normal
By
function.
definition, those people go back to normal very quickly. Fortunately, many stroke patients recover also, but their recovery is often more prolonged.
Okay. Now, Sylvia, I'm going to come to you for a minute because I want to get you some questions. And one of the questions I have for you is, are some strokes preventable? I mean, I know there are different types of strokes, and John had mentioned two different types of stroke. Are there some ways that patients can modify their behavior to prevent strokes?
Oh, absolutely. When you talk about what we call risk factors, those things that you can change or maybe not change that put you at risk for stroke, there's kind of two categories. There's what you can change and what you can't. And things that you can't change are things like age, family history, your own medical history, things that have happened in the past. What you can change are habits. Some of them are habits and some of them are conditions that you can treat, things like smoking, high blood pressure, diabetes, having high cholesterol, not exercising regularly. A lot of the things that we all know that put us at risk for other things also put you at risk for stroke.
Now, one of the questions that either one of you can answer this thing is there a family history? So if we have a family history of stroke, even though I may not have a family history of hypertension or high blood pressure or cholesterol problems, do I still have an increased risk of stroke associated with the family history?
Yes, you do. You do have that. And that's one of those risk factors that you cannot change. You can't do anything about history. So that makes it that much more important to pay attention to the ones you can change, such as not smoking or keeping blood pressure under control, keeping diabetes under control.
And are some behavior modifications, and I don't know this, but I'm going to ask, some things like exercise. We see this in heart disease. Is this also an effective thing in stroke, that we can do some behavior modifications, like, as you said, stop smoking? What about exercise and things like that? In general health issues, does that help with stroke also?
Absolutely, yes.
The other question I have for you is, we talked a little bit about some behavior modifications. What are you suggesting in your patients that come to you prior to strokes? I mean, you've got other issues. If you are doing lectures and things like that, what are you telling them other than decreasing your cigarette intake or decreasing alcohol? What are some things that you're telling patients are good things that you can do to prevent risk factors for stroke?
I think some of the things, I mean, I tell them, typically in my role I see patients after the fact, but I do occasionally get to talk to people before the fact, and those are things, yes, exercise, trying to maintain a good weight, a healthy diet, those kind of things are very helpful, along with, again, controlling all of those other things, high blood pressure, diabetes if they have them, you know, all of those things. Stroke is a vascular disease, so such as heart attack too, so they're all closely related. Things that you can do for one is good for the other, typically.
Now I want to take a little bit of a turn here, and I want to talk a little bit about some of the symptoms and the signs that we see that patients present with stroke. What are some of the signs that people can say, you know what, this is something I need to be careful of, this could possibly be a stroke? John, you want to take that one?
Right. Well, first of all, I think it's helpful to know that stroke symptoms generally come on suddenly. So unlike other disorders of the brain or problems with the nerves or muscles, these are generally symptoms that happen all of a sudden. Now, sometimes they happen in the middle of the night and a person will wake up with the symptoms, but often it's the suddenness that distinguishes stroke from other conditions. And some of these things are things we've kind of mentioned already, which is weakness, paralysis, commonly on one side of the body. That's probably the single most common symptom of stroke. Other things, changes in speech, slurred speech, garbled speech, inability to get out words, or inability to understand speech. Numbness, tingling, often again on one side of the body, sudden vision loss, sudden dizziness or vertigo. Occasionally a very severe unexplained headache can also be a sign of stroke.
We're going to be right back after these messages, and we're going to continue to talk about stroke, its prevention, and we're going to talk about some of the treatments that are now out there available for us. We'll see you after these messages.